Good morning. I am State Senator Shelley Mayer, representing the 37th Senate District. I'm also the chair of the Senate Education Committee. Today is Wednesday, August 5th, and this is a roundtable discussion of the Senate Education Committee on school reopening guidance. I'm joined by many of my colleagues, both from the committee and from the Senate at large, who I will acknowledge. But I want to say, because we have limited time, we will be joined first today by Commissioner Howard Zucker of the Department of Health for the first hour, or as much of that as he can stay, with some of his staff, including Jill Dunkel. And then from 11:30 to 12:45, the Chancellor of the Board of Regents, Betty Rosa, and Interim Commissioner of the State Education Department, Shannon Tahoe, will be joining us, as well as members of their staff. I'd also like to acknowledge for the first part, we have Dan Fuller, the Assistant Secretary for Education, joining us. Thank you to our guests for being willing to be here, answer our questions, albeit briefly, and we look forward to hearing from you. The purpose of this roundtable discussion is to get a firmer understanding of the school reopening guidance that has been issued by the Department of Health and the State Education Department, and ask questions that have been raised regarding implementation of the guidance. The issue of reopening and how schools reopen impacts our children, the lives of New York parents who have had to pick up the pieces during the past several months, and the physical, emotional health of students, teachers, and staff. Many of them have done everything in their power to address this extraordinary challenge we face. We acknowledge and thank them, all of them, superintendents, boards of education, teachers, staff, parents, for having helped us through a very, very challenging period. It is incredibly important that schools are engaging with state and local health officials, with our parents and our families, and the entire school community, including our elected representatives, to ensure a confident and transparent understanding of the protocols related to reopening, testing, and a process should someone test positive. We have asked our guest to briefly, and I mean under 10 minutes, walk us through the guidance they have issued and answer questions that we have regarding reopening expectations. We thank them for participating in this important conversation. There's some ground rules which unfortunately are very limited, but I will go through them after a brief statement by our guests. I'm asking each member of the Education Committee to limit themselves to 3 minutes, which includes the answer. The chairs of the Education and New York City Education Committee, that's Senator Lieu, will receive 5 minutes, as well as Senator Little, the ranking member of the Education Committee. If time permits, we will have an additional round of questioning. If other members have questions, please send them to me in the chat, and if there is time, I will do my best to raise them. I want to acknowledge so many members of the committee and others who are here today, including Senator Addabbo, Senator Brooks, Senator Betty Little, the ranking member, Senator John Lieu, Senator Robert Jackson, Senator Jen Metzger, Senator Toby Stavisky, Senator Martinez, Senator Montgomery, thank you for joining. Senator Seward. I believe we also have Senator Todd Kaminsky, Senator Simcha Felder, Senator Carlucci, Senator Hoylman, Senator Kaplan, Senator Gallivan, Senator Comrie, Senator Tedisco, Senator Kennedy, and I may have missed Senator Persaud. Did I mention her? If I missed anyone else, please write me a note and I will make sure to acknowledge you. I want to thank my colleagues for being so terrific and engaging so heavily on this issue, which matters to all of us, to our constituents, and actually to the whole state of New York. So with that, I would like Dr. Zucker, if you would like to begin some opening comments. I think we are not using the timer, but I am not going to hesitate to be abrupt when I feel time has to be called.
Thank you. And I want to thank the Senate Education Committee and Chairwoman Mayer for scheduling this important discussion. I'm here speaking this morning on behalf of the Department of Health, which has been working tirelessly since early this year to limit the spread of COVID-19 and to guide the decisions that we make about how to reopen safely. During our fight to manage the COVID-19 pandemic, New York State has faced a challenge that once seemed insurmountable. Since March of this year, in partnership with every New Yorker, we have successfully flattened the curve. Test positivity rates are down to around 1%. Hospitalizations and fatalities are down to their lowest levels in New York State since the start of the pandemic. So far, New York State has navigated through several critical junctures, and now we stand at another one. Reopening schools across the state is one of the most critical parts of our plan to reopen New York for our children and their development and for the well-being of our entire communities. But above all, we must keep children, teachers, and the staff safe. An ill-prepared reopening could put students, staff, and parents in peril, not unlike many states that reopened its businesses too quickly and caused hospitalizations, cases, and deaths to spike. As residents resume public activities in congregate spaces, from workplaces to houses of worship, schools, we determined that the only way to reopen safely was to establish statewide metrics and track and enforce them on a regional level. And we are applying the data and the science to the metrics-driven guidance for reopening New York State schools for in-person instruction. Issued on July 13th, our guidance establishes a minimum standards for school facilities to conduct in-person instruction at pre-K to grade 12 schools during the COVID-19 public health emergency. Our reopening guidance is informed by two critical metrics. The daily infection rate in the region where the school is located must be below 5% using a 14-day average since New York on pause was lifted. And if after August 1st, which just passed, a region's infection rate rises above 9% using a 7-day average, schools in that region must move to remote learning. At the core of our guidance is prioritization of in-person learning if at all possible. The latest advice from the American Academy of Pediatrics says children learn best when they are in school. We don't want students to fall behind, especially those that do not have homes conducive to efficient remote learning. However, the governor has repeatedly made clear that we are not going to reopen schools in New York unless we know the viral infection is safely under control in that particular part of the state. Broadly, our guidance for resuming in-person instructions calls for schools to have specific plans to implement prevention measures such as face covering, social distancing, and reduced density in the school. Screens for symptom, including daily temperature checks, containing the potential transmission of COVID-19, and close school facilities and halt in-person instruction if necessitated by local virus transmission. We have provided detailed guidance and have collected reopening plans from all the school districts across the state. Since the deadline for plan submissions on Friday, since we received it, the Department of Health has been reviewing each plan to ensure it accounts for these considerations, which include the social distancing and the face covering, the gathering and operational activity, hygiene, cleaning and disinfection, communication between districts and families, screening and tracking, and plans for testing. So this includes working closely with the local health departments, the regional authorities for necessary testing and contact tracing. We are not recommending that every student get tested to return to school only when they have visible symptoms. But every district must have a plan in place for testing of symptomatic or exposed individuals. That includes timely delivery of results and any ensuing testing of additional individuals. And each school must have a designated quarantine room for symptomatic or exposed individuals identified during the school day. I realize this is a stressful time for parents across the state. As the governor has pointed out, the final decision rests with the parents on whether they will send their children back to school. Each school district must work with its stakeholders, the school administrators, teachers, parents, families, local health departments, to achieve a plan that the community is confident will provide safe and healthy in-person instruction. It's important that we look at our state's successes so far in creating our response going forward. New York State flattened the curve by identifying positive cases through diagnostic testing, by aggressively tracing and testing the contacts of those who are positive, who test positive, and isolating those infected, and by emphasizing the importance of strategies to stop the spread that we all can take, like mask wearing and social distancing. Basically, the same measures we are asking school districts to implement in every school. If there's any piece of advice I could give parents, teachers, and staff this year, it's to stay home if you or your child feels sick. And our success relies on vigilance and resolve on the part of all of us, but it is possible. And I'm happy to take any of your questions.
Thank you very much, Doctor. And I see we've been joined by Senator Liz Krueger, Senator Sue Serino, and I see Senator Lewis here. I'm going to start briefly and not use my 5 minutes. Could you clarify what you just said about testing for asymptomatic children or staff? You know that parents are concerned that testing involves delays There's also not enough quick testing for those who think they may have been exposed with quick turnaround. So what is the Department of Health's recommendations for districts with regard to testing of asymptomatic students or staff, and particularly if there's been an outbreak or some degree of positive results within the school?
Sure. So I think I also have Kristen Navarro on the line, and probably the question first. Kristen, are you there? Oh, sure. All right, Jill, are you on? Jill, can you address the issue of the asymptomatic spread? If not, then I'll address it.
She was here, but I don't know.
All right. Well, it goes back to the issue with let's see, find out if Jill's on. Goes back the asymptomatic, like I was saying before, that we are concerned about any of the individuals who are symptomatic, and that would require obviously testing of their temperature initially when they come to school, before they even get to school for that matter. The asymptomatic individual, we know that they can spread the illness, but if there's we are not asking for testing ahead of time at that point. We have the criteria for reopening, obviously, which I meant to speak, which I spoke about. But the actual testing of an asymptomatic child, we're not saying that they have to do that. Are you concerned about the fact that they may spread it? Is that the concern?
Yes, both that they may spread it, or that you may find a week later that there's 3 or 4 students or staff who tested positive, and then parents may honestly have concerns about sending their kid back to school where others may have been exposed and are asymptomatic.
So this is Jill. So in the school reopening guidance, we do, ask the schools to conduct the daily screening, including a temperature check of the students. And so students who do present with any sort of a symptom related to COVID-19 are going to be asked to be quarantined at the school and then see their healthcare provider to ensure that they are not symptomatic and that they do not need to be tested for COVID-19.
Okay, I think you're going to have, honestly, some pushback on this from parents and staff who have legitimate concerns about asymptomatic carriers of the disease. So I just think that's something we have to continue to look at. Secondly, the DOH guidance requires students or staff who require containment to be isolated while at school. Many schools, including those in some places in my district, do not have school nurses in every building. Currently, there are not nurses in every building in New York City as well. How do you propose that schools should deal with the health risks posed by a child that needs to be contained, or a staff member?
So I think this is a great question. I think that part of it is that this is where this needs to be tailored to each school. So you're right that some of them do not have like a school nurse around. And is there a way, I once spoke to the schools about this, whether they share a nurse, whether there's a way to do telehealth with them if a kid comes in who's suddenly sick, and they bring them to an area that's separate in the school for an evaluation. Because I think the key part of that school nurse is to really identify that sick child and try to both isolate the child initially, but also to try to find out who else was around. Once there is a questionably positive kid, then that school should obviously contact its local health department, and they should come in and have follow up on it. The most important part, obviously, is if the kid's sick, what to do with that child at that moment in time. I think that the school should have a plan, as I mentioned, about some area where to put that child. But are you worried that they will not be able to do that part, because that's part of the plan or the ask of the plans?
Well, again, I am addressing the concerns of parents and staff members who have these legitimate concerns about the operationalizing of these protocols and what it really means for their child. And I want to make sure their questions are answered to a degree they feel confident and satisfied that they can send their child to school if the school is open.
So when we look at those plans, I mean, that's part of it, but we should, you're right, the family should not feel this sense of unease about going into that school with those kids. But the nursing part, I think the school nurse is something we could address on that.
Okay, I see I used up my time. Senator Little, you have 5 minutes, and then Senator Liu 5 minutes, and then we will go to the other members.
Thank you. Thank you, Dr. Zucker, for being here. I happen to have grandchildren that are in California and Kentucky and Tennessee. So I'm seeing too what's going on in other states. And I guess there is some comfort in that we're all having the same problem as finding ways to get our
Whoops.
49.
Senator Little, we're losing you.
Okay, I'm better now, I think.
Okay, go ahead.
So I have a number of schools. Certainly my smaller rural schools have a lot of space because they've had declining enrollment, and they will be able to handle, I think, it very, very easily. But I have larger schools as well. I would have a question in regard to, I know some places are using face shields for children. Do you think this would be for younger children especially? Is that a good idea? Is that going to be protective?
I think, I mean, the protective, they are protective. The issue here is that to get a little kid to do some of these things, it varies from child to child, right? Some kids will put a mask on even if they're younger, other kids may not. And so whatever we can do is help. Obviously, a shield would be beneficial for a child, but the how compliant they will be is always something to address.
Yeah, I have a first grader in Kentucky that's going to have a shield around her desk, which would be extremely expensive for us to try to undertake. I have a question in regard to bus transportation.
Let me just clarify that at one point. Is that
Mhm.
you can have the shield, but you also need your mask there as well. So
You need to wear the mask and the
the shields are
shield?
good, but you need a mask under it. So you have
Well,
to.
that'd be tough for a child.
So that's what I was saying about the mask in general. Some kids will wear a mask, some won't. That's what I was sort of trying to. So they have to keep the mask on. They may not. So you were really wondering whether you could just wear the shield, not the mask. But
Absolutely. You see a
I-
lot of people doing that in grocery stores and all of that.
Actually, the CDC says you should wear a mask. You can wear the shield on top of that because some discussion about covering your eyes as well. But you need to wear the
Yeah.
mask.
Yeah, well, everyone should wear glasses, right? So maybe that covers their eyes somewhat. Bus transportation, you have 64 passenger bus, they're figuring they can only have 22 kids on it. But if they're all wearing a mask, um, and even if they get within 6 feet of each other, they're supposed to be able to do that, aren't they?
Still have to social distance of 6 feet unless you're in the same family. So I actually realize that the bus issue is a complex one because if you limit the number of kids on a bus, which we're going to have to do, that adds the number of buses. It makes it harder for these kids to. But that's that. I mean, that is probably one of the harder parts that we're going to have to manage. But the CDC and all the recommendations is to be 6 feet apart and to sort of space the kids.
But it doesn't make any sense and it's contradictory because wear a mask if you're going to be closer than 6 feet. And if you're not, and these kids are standing on a corner all together and they get on the bus and then the bus has to.
Right. So that this is part of the challenges of schools, which is that they really should not be gathering on that corner, and they should wear a mask. It's the combination of social distancing and the masks together because
Well, it's the only place the bus picks them up.
right,
They do
right.
not stop at everyone's house.
Yeah, no, I
And
get it. I totally get it. It's almost like sort of you end up with 5 or 8 kids spread out across uh, like lined up in front of that bus stop, go half a block down and probably into someone's neighbor's yard, which I
we've
get.
got to come up with better guidance because really the way that it's set up right now, it's impossible for these schools to conform to it without extra buses, extra runs, extra expense.
I know, I really do. I get it, and I think this is why I've always said this. The issue of school reopening is such a critical aspect here because of the potential for spread, but also the fact that it's hard to follow all of this and still get the kids educated. But I think that's when it comes to the public health and the safety, it's the best the best to do.
It's true, but on the education part, we're going to hear and talk about how, some kids did very well, and I'm sure you know some that did because their internet service was working and good. They had it, and they actually learned things, not to the extent that they would have in school, but some children did nothing and got really nothing out of this. And particularly special ed kids who just no way can they conform and work online when they need special attention. Those children, I can't imagine them not getting some help in school. So there's just a lot of contradictions in this, and the more you can clarify and the more you can come up with the guidance that's actually workable. Um, you know, the easiest thing in the world would be to keep the schools closed, but now nobody's going to benefit from that. So
Senator-
I just think we have to make it work. Thank you.
Sorry, Senator Lou. Senator
No,
Lou.
that's-
Senator Lou, you have 5 minutes. Are
Thank you,
there-
Madam Chair, for putting this roundtable together. It's very much needed, appreciated, and timely. I have questions that will somewhat piggyback off of what Senator Little has asked about, which is the ongoing uncertainty of school reopening all throughout the state of New York. And in my responsibility as chair of the New York City Education Committee, the reopening of schools specifically in New York City. There's been some news lately. Well, apparently there's always news in New York City, as is the case with the rest of the state. My question for you, Commissioner, is probably not so much along the lines of schools themselves, but communication and coordination. For example, we have a health department in the city of New York. We also have a Department of Education. To what extent does your office coordinate with our health department and or our education department, both of which are relatively large agencies, obviously have a key role, but yet there's a sense among lots of New York residents, particularly parents of school kids, that the left hand does not know what the right hand is doing, at least within the city.
So I two parts to that answer to that. One is from the standpoint of communicating with the city, always in contact with the city health department, not just myself at the senior leadership level, but also within our agency and working at a operations level as well. So that's one part. The city education department, we don't directly interact from the health department with, but we interact with the state education department up here in Albany. And we've been looking at some of these plans and working closely with them because this is an area with true overlap between health and education. I can't speak to the cities, what is happening at the city health department, the city education department. But perhaps the assistant secretary, has more information.
Yeah, I mean, we have always heard from the chancellor and the mayor that, that they work in close coordination with the health department, the health commissioner, which, we just had a changeover yesterday here in the city of New York. And that the health and safety of the children and the teachers and the school staff are of paramount concern. And yet, there's some question as to exactly how much of this the chancellor and the school department, education department is actually taking into account. Presumably, the city health department is in close coordination with the the Department of Education in New York City. But at some point, does your department have to actually approve what the New York City Health Department is telling the schools department?
So there's 650 school districts, right? And there's 280 charter schools and 1,500 private schools, and all of them need to provide reopening plans to us. So we've looked at all of these plans. There are plans that we're still trying to better understand with the city plans that were submitted. So we've looked at that, but that hasn't, we need to flesh that out a little bit more about the reopening plans.
Okay, so you're being kinder and more diplomatic than the governor, who's basically said that it's a non-plan of a plan, that it's no more than an outline. So I take it that the state health department that you lead does not consider the New York City reopening, the New York City school reopening plan to be anywhere near sufficient to the point where the schools would actually be able to open.
Well, what we would like to see on this city plan is a plan that shows engagement of the community, the parents, teachers, and all the others. And it's sort of a skeleton plan at this point. And so we need to see that fleshed out more before we're comfortable with it.
Okay, and speaking of,
yeah.
speaking of being comfortable, you know, the governor clearly said that, look, I mean, the schools could reopen it, but if the parents don't feel comfortable sending their kids into these buildings, then they're not going to. And I guess there is an option for 100% remote learning. But what about the teachers? The teachers clearly have a huge stake in this. To what extent does the Department of Health actually coordinate with, like, for example, the teachers union? The Chicago teachers apparently have announced or got the system to go to 100% remote learning. Here in the city of New York, we have significant and substantiated concerns from the teachers that the schools may not be safe enough to reopen.
Is Dan is on,
Yep.
right?
Yeah,
You want to chime in on that?
sure. So we've been working with the teachers unions, both in the development of the guidelines and also as part of a number of other outreach, including the Reimagine Education Advisory Council. We've also been working with other education stakeholders across the state on this. So I just want to be clear that we have heard from stakeholders on this, including the teachers, but also principals, parents, family members, children, and others. So our outreach has been pretty extensive as this guidance was developed.
Senator.
Thank you. And thank you, Chair, Mayor, for having all of us on this. I know we'll have great questions from our other colleagues as well. Thank you.
Yes, and I apologize, it's so short. Senator Jackson, and then next I have Senator Seward.
Thank you, Chair, Mayor, and good afternoon to everyone. Commissioner, let me thank you for your service. I know it's a tough job you're in, but I'm sure you're up to the task and responsibility. I have two quick questions because I only have 3 minutes. So let me ask the first one, which is a constituent of mine has put this to me to ask the question. She's probably watching on the Senate website. Why is there a delay in rapid testing, considering that parents want to send their children to school safely to return to in school, but without rapid testing, they're concerned about, the contract testing won't work. I know that in Virginia, my daughter, who is a pediatrician herself, she's on vacation. And so before she went on vacation, she went to her location and got a rapid testing and, in order to make sure that she was safe with her family and us coming down. So can you just tell us why the rapid testing is not up and running right away, and what's your opinion about children returning to school and staff without rapid testing? You need to unmute.
There you go.
Okay.
So on the rapid testing aspect about this, so we're doing 80,000 tests per day now. Most of them are done within our state facilities, not just state operated facilities, but in the state. But a certain percentage are still done through LabCorp, Quest, bioreference labs, and those are showing a longer delay because they're getting many more tests from around the country asking. So that's what's pushed it out to 7-8 days. In state is 2 to 3 days. We're still sitting on a relatively quick turnaround time. The rapid tests, like the 20-minute tests, but that's a little bit different. These are Abbott tests, there are antigen tests, other tests that are antigen tests, but by and large, the test that's the 20-minute test, there's only so many of those machines there, and there's so many diagnostic, the actual materials that we need. This is where I always go back and say that we should have revved this up at a federal government level and made a lot more of these a lot quicker, and we would not be sitting in this challenge. But we're trying to push that as fast as we can. We recognize in the city a lot of children, there's a lot of children, and if you wanted to test all of them, but that would not necessarily be as urgent. I get your second point. Your second question is, how do I feel about having a kid?
No, Commissioner, I just have to ask this quick question. I only have 30 seconds left.
Yeah,
I'm
sure.
so sorry. But my next question is, as far as the New York State Department of Health, what about children with IEPs that go out of state into New Jersey? Where's the coordination and whose responsibility for the children that attend schools in New Jersey? and
We-
taking bus transportation?
We are working closely. Yeah, I'm on the phone every week, usually once, sometimes twice a week with the New Jersey and Connecticut health commissions to discuss some of this. We were on the phone yesterday talking about how are we coordinating on all different issues. And that was one of them that came up that we're going to try to follow up on.
And I
as
would
well.
assume that if they're in Jersey, the deciding factor is Jersey. Is that correct?
Right. Well, in New Jersey, I mean, it depends. If the kid's here in New York, then.
Yeah,
you know,
but they're going to school in New
the school
Jersey.
over there, every New Jersey school, right? Every New Jersey school that would make a decision about what to do with their school. Correct. That's correct.
Thank you, Madam Chair.
Thank you. Thank you, Senator Jackson. Senator Seward and other members, please put your hands up on the chat so I can make sure to recognize you. Senator Seward.
Yes, thank you, Chairwoman Mayor. No question, Dr. Zucker, that it's very, very important for us to give parents, faculty, staff, students a sense of security when they're going back into the school buildings. And let's face it, that's where the best learning can take place, is in person. But we have to make them comfortable doing so. With that thought in mind, could you quickly walk me through the screening that will happen every day that the school is open? Did you mention about taking temperature
Yes. Yes.
every day?
Every day, every child, and also questions to ask if they're sick or not. And we recognize that kids, kids sometimes walk around, multiple times during the school year with a cold. So it's really important to get that information from them pretty quickly.
Would the temperature taking also include faculty and staff?
Yes, everybody has to be done. Yeah.
Following up on Senator Jackson's questioning regarding the quick results testing, I think that would be very, very important to be able to help put everyone's mind at ease if we had quicker results. When do you think that this 45-minute results testing will be available widespread here in New York State? Is that a pipe dream, or is that something that could happen fairly soon?
That's an issue of trying to get these not only the swabs that you need, but also the machines. And if you think about, if it's 20 minutes, so you can run, let's say 3 an hour, let's say you could even run 4 an hour. But in reality, that's minor. You'd have to have like 15 of those machines. You'd have to have them everywhere to sort of be able to pull this off. And we're not there. And until the manufacturing of these devices and the manufacturing of this equipment is revved up, I don't see us getting there. And so that's why the other tests are probably, if we can push that down to a day, or which we have sometimes a day or 2 days, that would be the best thing to move forward. And that's why it goes back to your first part of your first question, which is why the temperature checking, the issue of symptoms, the issue of whether anyone's sick at home is so important. The history is really important. And I will just tell you that one of the old rules in medicine was that, from a history and from a physical exam, like some vital signs and things like that, usually can make most diagnoses. So if you hear the history of like, well, so-and-so is sick in my house and I really heard the story, you could pretty much pull things together with that and with a temperature check. So I think it's really important. And then precaution, the mask and the social distancing.
Mm-hmm. Just quick follow-up. In terms of the cost of the testing, who would bear the cost of the testing? Are we looking to the school districts or the parents or family? Who's going to bear these costs of testing?
Dan, did you want to address that on the issue of the coverage, insurance and coverage?
Sure. We have free testing in New York, and then there are also insurance programs and things like that. Individual schools will have to have a plan to consult with local health providers to ensure that kids are getting tested. They'll have to have a point of contact and a process for them to go through. And as part of that, the testing will be included at some cost. Not that the schools will pay for the testing, but there are payment options that are available either through insurance, through New York State right now, where we're doing testing for individuals. So,
thank you.
Senator Metzger, and then Senator Dabo, and then other members, please make sure I know if you have a question. Senator Metzger.
Thank you. And thank you for being here, Commissioner, and thank you so much, Senator Mayor, for leading this roundtable. I'm going to try to squeeze in two questions. One is, could you just walk through the process of what would happen, say a teacher is suspected of being positive or a fellow student, it takes some time to get the test results, they're quarantining. What kind of communication happens with fellow students? What happens from there? What kind of communication happens with fellow parents? Should they all be quarantining? If you could just walk through that process.
So this is a communications issue and it's a public health issue. So once you find out the child is positive, obviously that child needs to be cared for, evaluated, and so all the necessary public health and medical issues will need to be taken care of there. But then there's the contact tracing. You need to find out who was that child exposed to, both the kids in the classroom, the teacher, and then our contact tracing team will obviously be working with the local community, local health department to get that information and to figure out the testing of those individuals, how long that they need to be obviously quarantined for, the issues of what was their exposure, whether they have any other medical problems to make sure that's taken care of. Kristen, do you want to add, chime in on this? Because you've been looking at this for a fair amount.
Yeah, absolutely. And good morning, everyone. Sorry about the technology issues earlier. So all of the schools, as part of their plans, are also required to have an extensive communications plan with the entire community, including parents, teachers, staff, and other relevant community members. So each district is going to be unique in their communications plan so that it ensures that it addresses their communities best. But they should be including their plan for communication with the entire community as part of their plan for those types of situations when there's a suspected case, a confirmed case, and how it will be handled.
So, could I ask if there are concerned parents that a plan is not being followed at the district level, who do they contact? Is there going to be, who's the point of contact at the Department of Health, for instance, or do they follow up with the county, or is SED going to have a contact for parents? That communication is going to be really important.
Yeah, so I'll defer to Dan about the SED contact, but certainly for the Department of Health, we have a complaint line that can address any complaints that an individual citizen may have about non-compliance with any of the New York Forward reopening guidance, which would include the school reopening plan.
Okay. And just quickly, this is just a comment, one point. To make this all work, it is requiring additional resources by school districts at a time when they don't have it. This is very expensive to make these changes. I represent districts where many households don't have broadband. They're trying to address those needs. And you're part of a team, Commissioner, in the executive, and I want to bring back the importance of making sure we do everything we can to make sure our school districts have the funding to meet these needs of their children and staff safely.
I hear you.
Thank you, Senator Metzger. Senator Dabo.
Good morning, everyone. Madam Chair, thank you so much
Good
for
morning.
today's roundtable and for your efforts. Commissioner Zucker, thank you very much for your time and efforts as well as all those from the administration. Thank you today. A quick question. On the heels of the virus, we had many portals in which residents can go into a portal online and ask any question, get some feedback. Leading up to the possible reopening of our schools, is there or can there be a portal with either the Department of Health or SED where parents, maybe even teachers, can go onto this portal, ask a question, and get response back? As you heard from my colleagues, many of us are faced with constituents who are coming to us. Can we refer them more directly to the state and through a portal?
Well, we're always open for any ways to increase communication between the families, the schools, the legislature, and us. Kristen or Jill, is there a portal that we could set up or we have?
This is Jill. I mean, we do have an email box where folks can certainly send their questions about school reopening, and that is schoolquestionscovid@health.ny.gov.
And I'm sorry, my shorthand is not that good. Can you please repeat that?
Sure. School questions with an S, COVID@health.ny.gov.
Thank you. And that would be for all related school opening issues that parents or teachers may have, correct?
Correct.
Again, thank you so much. Thank you, Madam Chair.
Thank you. And I'm just going to take privilege to say that respectfully, I think you're hearing from all of our colleagues our constituents want more direct access than an email. And I'm asking that this idea of either a portal, a hotline, or something else on these health issues for teachers, parents, and staff is essential to instill confidence in those that are sending their kids to school and those that are working in school. So appreciate an email, but respectfully, it's not enough.
We'll work on that. I hear you on that. I could do one more question, I'm just looking at the time.
Okay, so I have Senator Stavisky, Senator Montgomery, and Senator Martinez. Senator Montgomery, do you have a question?
Here.
Do you have a question, Senator Montgomery?
Thank you. I would like to hear what the commissioner is doing to ensure that the school-based health clinics are part of the testing wherever they exist in schools and are available to both students and faculty and staff for testing purposes in particular. And thank you, Madam Chair, for allowing us to be able to ask and have this discussion.
I think that the key issue, what you're asking is, can the school-based health clinics serve a role in this, and they will work with them. I mean, they play a critical role for these children, in regular times, not in COVID times, and I could figure out how we can get them to provide a role at this time as well. But I think this goes back to the issues of what are the school plans. If a school has a really strong health clinic there and they're working with their local community, that's a way where kids could get tested, or if they need to get tested, or there's a place to go if the child's sick, then that would be great. And so I think this is why some of these plans, or all these plans, need to be tailored to the community with an overarching theme about what we need to do if a child is sick, and also how to protect them. Just so you know, the rest of my team will be able to stay on the line.
Thank you.
I'll do one more, and I'm looking at the
Okay.
time. I need about 10 minutes to walk over somewhere, so I have one more.
Okay. Senator Montgomery, do you mind if I jump to Senator Stavisky? So I have one more question.
That's fine.
Senator Stavisky, do you have a question? She muted. Okay. Senator Martinez? Okay, if you don't mind, Commissioner, I just have two quick follow-up before you go. Was one of them there? There's a whole series of questions about the health issues related to special needs children, both wearing of a mask, the additional needs of potentially of cleaning or of addressing some of the issues involving where they sit and are taught if they're in school. I know there is guidance there, but can you address at all whether the department is considering their needs in a sort of a separate way from a health perspective?
So a couple of things. One is, one of my dear friends, actually one of my former patients, from 30 years ago, is a special needs teacher in New York, and she and I had a long conversation about this the other day, about the challenges of these kids, and I feel that we are addressing this, but we also realize that there's a difference to what they can do versus what the average kid can do. And you just brought it up about the masks, and also you can't ask someone sort of, if there's special needs, to sort of say, okay, 6 feet apart, and these are the rules. And so we are trying to tailor this. And that's why when I mentioned about these plans have to be tailored, they especially need to be tailored for the special needs kids, and also how these kids get to the school, and all of these issues. So we are looking at that along with other departments, other parts of other departments within the government.
Okay, thank you. Thank you.
I think you went on mute.
Oh, I'm on mute? No.
And we lost you.
No, I'm here.
I think we lost you.
Okay.
Can't hear you, Shelley.
Yeah, there you go.
Well, now can you hear me?
Stand by.
Shelley, if you get a chance, I have a question too.
If we can reset the clock and have Senator Martinez go while we figure out Senator Mayer's sound issue.
Good morning. Can you hear me?
Yes, Senator, you may proceed.
Great, thank you. First of all, to the commissioner, thank you for being with us here today and everything that you've done throughout this whole pandemic. My question is in particular, I know we spoke a little bit about the IEPs, but has there been any conversation or any special procedure for after school activities that the school districts must submit? And also in terms of health issues, the bathroom monitoring. I know different school districts do different things with the bathrooms, but how are we maintaining the health and safety when a child is using the bathrooms?
It's a great question. The first part, we do have the plans, and those are the plans that are coming in that we're evaluating. The bathroom issue is going to have to be part of those plans because it also depends on each school. You may find a school that actually has one bathroom on the floor and they don't want the kids go, or one bathroom every other floor, and they don't want the kids to go to a different floor. And so now you run into a different challenge than the kid who has two bathrooms on the floor and it's like, no big deal, you can go here, you can go there. That's why I keep saying that these things have to be tailored to each school. That's why we've looked at all of these plans and trying to be sure that these. I actually feel in a lot of ways that the schools themselves know what the challenges are. Because someone may say, oh, I know every time between this period and that period of class, every kid runs to the bathroom here, and now we're going to have 16 kids in the hallway. And another school may say that never happens. So I really think that we need to tailor per school. And that's where we're asking for, and that's where we're looking at the plans and we're going over them. Jill or Kristen, is there something I'm missing?
No, I think.
And what about the after-school activities, Commissioner?
So
or
that's-
any type of material that children will be cross-touching?
So we're going to have to make sure that is addressed as well. Jill, you were going to say something about both of these issues?
Well, I was just going to comment on the bathrooms that I know some of the schools in their plans are stating that they are going to put a physical barrier between the sinks, and also limit the capacity in the bathrooms, which could be problematic if there aren't sufficient bathroom resources. But as Dr. Zucker emphasized, this is an individual plan for each district and for each school. So they are taking that into consideration. As for the after-school activities, we do have to, that is an extension of the school day. So we do have to take into consideration the social distancing, the wearing of cloth face coverings, and also really try to reduce the number of high-touch items or shared items among students.
And how would a school district go about doing that? Let's say, for example, a school district has limited classroom sets on a textbook, and each child will be using period to period. Are there plans on that?
Again, those have to be individually tailored. I know some school districts have gone to online textbooks. Some have also taken to photocopying material for students. So again, it has to be handled on a case-by-case basis at the schools.
Okay. Okay, thank you.
Senator, yes, I'm going to jump, but I'm going to make sure the team stays on. Is that okay? Oh, we can't hear you.
Still can't hear me. Okay.
I hear Shelley now. Thank you, Commissioner.
All right. Thank you very much. Thank you, Senator.
Thank you, Commissioner. Could we have Kristen? Are you going to join us via camera, Kristen? And we have Dan here as well.
Yep, so this is Kristen. Unfortunately, I'm not in a location that I have a webcam set up, but I'm happy
Okay. All right. Senator Mayer, do we have your sound back?
Can you hear me?
Yes.
Okay, good. I'm sorry for the technical problem. Other members of the committee, Senator Brooks, Senator Stavisky, anyone else on the committee, Senator Seward, Senator Little, who has another question for the health department. I have some, but I will defer to you. Anyone, Senator Lou? No? Okay. Can I ask you?
Senator Little.
Chair Mayor, your sound is out.
Oh, okay, Senator Little.
Yeah, just one other question. I know that the commissioner keeps talking about tailoring it for every school, but a school doesn't want to end up finding out they didn't do it the right way. And sanitizing, is it all spray sanitizing? Are they supposed to be using lights? to sanitize or decontaminate? What is the plan, or what are they supposed to be doing?
So this is Jill. So every school does have to have a plan for both the cleaning and the disinfecting or sanitizing of those frequently touched surfaces throughout the school, bathrooms, hallways, desks, etc. And there are guidelines on the types of products that are effective against COVID-19 and that are approved by the EPA to do that.
But they have to do this constantly, and this is going to cost a lot of money when we get all through with this. And yet the value of an education is still important. It's just going to cost more to provide it through this.
So this is Kristen. So yeah, we completely understand. I think a lot of the challenges with COVID and implementing the public health requirements is that there at times is an increased cost. And certainly that's why we want to leave it up to individual school districts to ensure they're finding a way to meet the minimum requirements for cleaning and disinfection in a way that works best for them and their individual constraints.
And something has to be done to allow more kids on a bus to be sitting in a seat with a mask on. And if you have a family member, they could sit next to you. But otherwise, you can't have to be looking at empty seats, that many empty seats anyway. Somehow, if you could just look at it again.
I just wanted to jump in on the cost piece of it too, because the governor has been very clear. We need the federal government to step up first and foremost. These expenses that schools and other sections of our economy are facing are essentially unprecedented, and we have not had this challenge before. And this is the sort of thing that we need the federal government to provide the funding for us to do that.
Thank you, Dan. I just want to, Senator Liu had another question. We've been joined by Senator Savino. Thank you, Senator Savino. Senator Liu?
Yeah, thank you, Madam Chair. So excuse me, just want to clarify. I know that Commissioner Zucker had to leave us, but he started talking about in response to my last round of questions, the concept that the New York City Department of Education has to submit a reopening plan that is going to be approved by the New York State Health Department. Is that what I heard correctly?
So both the New York State Department of Health and the State Education Department are reviewing all the plans that are submitted. So we at the department are reviewing what was submitted by New York City, which is a framework, and we do expect a more robust plan to be submitted.
Okay, so basically the New York City Department of Education and presumably other districts as well throughout the state, they have to pass both the requirements of the state health department as well as the state education department.
And I'm sorry.
So it's basically like two different standards or two different sets of criteria, as opposed to the state health department coordinating closely with the state education department, and then having the school districts, kind of like satisfy one unified entity?
Well, there's two aspects to this, right? There's public health and safety, which are the Department of Health guidelines, because they are the experts on the public health. And then there's the education aspect, which is the state education department. What the folks at the Department of Health are doing is they're looking to make sure that, and all schools are required to, when they submit, say they are meeting these guidelines, they have submitted a plan that meets the health and safety guidelines.
Okay. What if there's a conflict between the two state departments? What if there's a disagreement in terms of what, obviously from the education point of view and your agency's point of view, Dan, you're looking to make sure the kids get educated. And the more common sense of knowledge is that it'd be easier for kids to go into school classrooms and interact with not only their classmates, but the teacher. So from an education point of view, that is kind of like the desirable goal from a health department's point of view, their goal is to not have any more transmission of COVID-19, which means keep people apart as much as possible. So at some point, there's like push and pull. Who's the referee if there's a disagreement between the two state level agencies?
The guidelines that were put out by the State Department of Health and the State Education Department both clearly state that in matters where there is a conflict related to health and safety, the Department of Health guidelines are the controlling guidelines.
Okay, that's good. So then the more important thing is for Chancellor Carranza and the New York City Department of Education to satisfy what the health department is asking for. And right now, the as the governor calls it, the outline from the New York City DOE is gets an F for now, or it gets a continuing to assess grade.
Yeah, it wasn't, I mean, and folks have said this before, but it was an outline, framework. It was not complete. If you look at other plans, and there are plans around the state where school districts like literally specifically delineate quarantine rooms and things like that within school buildings. So, you know, there are levels of detail that were not in the New York plan that we'd be looking for.
Okay, but you're speaking from the education department's point of view. How about somebody from the health department?
I'm actually, I work in the executive chamber, so it's both education, but this is also health.
So you're the rep. You decide.
It's Department of Health that decides on the health and safety guidelines.
Right, okay.
Right, yeah.
To the extent that there's a little bit of push and pull, you're kind of, like you said, you're suggesting the executive chamber is the one that's going to be the rep and have the.
No, I think the guidelines are pretty clear, both SED and New York State Department of Health. When there is a conflict related to health and safety, the Department of Health guidelines are the ones that are the controlling guidelines.
Got it. Thank you. It's a good thing that the New York City Department of Education doesn't have any failing grades this year. They only have, incompletes. And right now you're giving them an incomplete. Thank you very much. We'll look forward to working with your departments as well as getting the Department of Education up and running with a clear plan for parents and students in the coming semester. Thank you.
Thank you. Other questions of committee members? Senator Seward, you have a question?
Yeah, yes, I do. This is on behalf of Senator Sue Serino, who's not on the committee, but she's asked me to ask her question. I think it's a good question for Dan, and then also perhaps the Chancellor when she appears before the committee as well. Senator Serino's question is: have you thought about if a teacher is uncomfortable teaching for any reason in person, could we allow them to be the ones to Zoom into the classroom and have an aide or an education graduate student in the room to supervise the students? So at least we know the students are actually paying attention to the lessons, also have access to broadband. And we know that they're getting other resources like their lunches. And there's someone who's actually monitoring their progress and report on any concerns. I would think that would be a good option for any teacher who's uncomfortable for a health point of view or is not feeling well, is showing some symptoms, that they could still teach from home, but the students are in the classroom.
Yep, and I'll let my colleagues from Health weigh in too on this, but the guidance specifically outlines addressing vulnerable populations. So teachers and others who may not feel comfortable going back in for underlying conditions or other areas, they do have, we require school plans to accommodate them, to have an accommodation for them. In terms of the specific staffing, that would be up to the district plans, whether they have somebody in the classroom or how they do the supervision, but that's within the district plans, but we do have accommodations within the guidelines.
Senator Seward, do you have more?
Yeah, just a quick follow-up.
Yes.
I just clarify with Dan. Now, so this would involve, the teacher being teaching remotely, but the students in the classroom. That was the point.
Yep, and I think the individual school districts would work out the specific plans. I think what you're raising is you don't want the kids in the classroom alone unsupervised with the teacher
Exactly.
on Zoom, right? Right, and the individual schools, I think, will work that out accordingly.
Thank you. So that option is available.
Yes, yep.
Other questions? I have a question for the health department staff on the contact tracing issues that arose in Greenberg, the Greenberg district, with regard to basically a contact tracing that I think did not go far enough in identifying those that were potentially going to be positive, and many did turn out to be positive beyond what was initially thought. Has the health department revised its approach to contact tracing in these kinds of cases after that incident?
So this is Kristen. I'm not familiar with the Greenberg incident. I don't specifically work on the contact tracing. We can certainly find out more information. But what I do know is that the contact tracing program is fairly extensive and works very closely with the local health department where the cases are. And it's an ongoing collaboration. So we can certainly check in with the team about that particular situation and certainly get back to you if there are any concerns or if there are any revisions being made based on it.
Okay, I appreciate that. The issue was proximity within a classroom. What constitutes the proximity for potential exposure for someone to be quarantined? And it was not interpreted broadly enough to capture those who in fact were in contact with a positive person. And the initial decision of the school was to continue to open until the union representatives working with the school pointed out to the county, and I believe the state, that there was in fact a greater risk than they had assessed. And as a result, the school closed. So these kinds of issues for how we're going to actually evaluate, I know it's deferred to the local health department, but there may be issues where we require stronger guidance from DOH on what is proximity and how should the evaluation of risk be handled to maximize safety. So I would ask that you go back and look at that. And I think, I know, Dan, you're familiar with that case as well, I believe.
Yep, and again, the local Department of Health got in, looked at it, said, well, we need to make some changes. So in many regards, the system ultimately worked, but I hear what you're saying on it.
Okay, appreciate that. Last question from me, and then I will go back to my colleagues on this issue of cost. Dan, I appreciate what you said about the governor's very strong press that we need federal money, and I think everyone on this call from the Senate completely agrees with you. That being said, is there a ongoing itemization of the costs? That are you asking districts to provide the cost so you know what they are paying? For example, for these shields, what will be reimbursable, what will not be reimbursable? Is there guidance being given to them as they make these expenditures?
So I can double check. I don't know if folks from health want to weigh in too. I can double check, but I know that we have had numerous communications with schools about expenses and tracking things, tracking expenses. I don't know that we have a set answer yet on how reimbursement will work. Again, much of this is dependent on the federal government stepping up and providing the funding needed for what is a national problem and a state problem, obviously, but a national problem as well.
Okay, understood. Well, that would be good to know the answer. Any other questions from committee members? No?
Yes, from
Yes,
Senator
Senator Metzger, I hear your voice.
So, in the previous pandemic, many schools, many classes met outside. And I know that, there are limitations to this, but it seems to me, just in some of the district plans that I've seen in my district, there is ample room. There are many parks with pavilions. There's opportunity for outdoors, and from a health perspective, reduces the risk of transmission considerably, especially when you're talking about older schools with not very good ventilation systems. And I want to just hear what you think about, just encouraging that. I know that it's mentioned in the DOH guidance, but to me, it seems like a really underutilized option. And not just, I represent a rural district, but, cities have parks as well. And just want to, if you could just speak to that.
So, just re-emphasizing that, all of these plans really need to be specific to the local situation and the local opportunities. And as you alluded to, that the plans do mention using alternative locations for educational activities, and that could be a covered pavilion or other locations in the community. And so, really working a holistic approach for this plan to make sure that the entire community resources are taken into consideration. If there are schools that don't have the space required, taking into consideration, ventilation, and as you, discussed, the use of outdoor spaces. I think that is important for every district to be taking a look at that holistic community approach of what those resources are.
Yes, and I appreciate that, and it's mentioned, but there's a difference between mentioning it as an option and encouraging it. It seems that if it's encouraged by the Department of Health, it's more likely to be considered.
Yeah, I think every, district is looking at unique opportunities, and some are, either staggering their day to reduce capacity, but others could be looking for alternative educational spaces. So again, it's really based on the scenarios that they're putting forward for both the in-person instruction, their hybrid model, and then their remote model, making sure they have those three components and utilizing the resources in their community.
Senator Lou?
Is that for me, Shelley?
Yes.
Yeah, I just had a quick question from one of our colleagues for our health officials here, which is that Commissioner Zucker mentioned that the intent was to look at students who come in with fevers. Are there any other symptoms that schools should be looking for, given that our understanding is that the CDC says only 44% of COVID hospitalizations actually exhibit fever?
So I think the schools are going to be conducting a screening and specifically the temperature check of all students, staff, and visitors to their schools. And the screenings will check for symptoms that are consistent with COVID-19, and that would include, fever, headache, respiratory symptoms, different GI symptoms. So there are a wide range of symptoms that they would be screening for.
Okay, but they would be screened based on a questionnaire, presumably, right? Because you can't really tell overtly if somebody has GI problems or if somebody has some of the other conditions you mentioned. Obviously, if somebody's coughing, incessantly, or just seems sick, that would be a warning flag. But is the emphasis on the fever and the temperature because that's really like the best overt measure that can be taken?
This is Kristen. It is challenging given that there are a lot of symptoms that individuals can present with for COVID, but I think what's helpful about temperature screening is that it is reliable, generally speaking, as opposed to doing a screening questionnaire. Hopefully parents are truthful in answering those questions honestly about any symptoms their child may have had recently. But doing a temperature screen is a more objective measure to help us out with screening. Additionally, we know that those who are febrile are more likely to have a higher viral load and be more likely to spread disease further compared to those who may have more mild symptoms. So when you combine those two things, we do think that temperature screening is an important part of the overall screening process. They're not mutually exclusive. I don't think that you can do temperature screening in the absence of asking about symptoms as well, but they really do complement each other.
Okay, thank you. Thank you, Madam Chair.
Well, thank you. Any other questions from committee members or others that? on the
I
sec-
do, Senator Mayor.
Yes.
Thank you. This is for the Department of Health, if they're still available, but a couple of questions. Has there been any type of discussion or are there plans to close a school, even if the county infection rate is lower, but our school community is now disproportionately affected? You know, we all may have different areas within our district that are more dense than others. So how is that going to play a role? And also, will a parent be held liable if they know they're sending a sick child to school who has tested positive and infects another student or a teacher?
So in regards to your first question about, shutting down, if the rates are lower than those of the region, I think those would be individual decisions made at the school level in consultation with both the local health department and the state health department. Those are not things that, we can really comment on right now. We'd have to look at the exact scenario, and those are some of the planning assumptions that schools were asked to integrate into their plans. What would be the individual triggers for them to reach out to their local health department to discuss either a partial shutdown or a full shutdown of in-person educational activities.
You had a second question, didn't you, Senator Martinez?
Yes.
Did you answer the second question on liability of the parent?
No, and I just want to make sure that, parents are very upset right now and they're concerned. And some parents may not even know if their child is asymptomatic. And that's a discussion that we had before. I just fear that a parent may have to be even more cautious because, yes, we know that parents sometimes send children to school sick. They have a little bellyache, and then they're being picked up at the nurse's office, right? So I just want to make sure that parents know their rights, that parents know what will happen in the event of, and I just want to make sure that there are no surprises for our parents.
I mean, I think the goal is to continue to emphasize with all parents and guardians that if their children are sick, they should be staying home from school for their own protection and for the community protection. So I think that's the messaging that we're going to continue to emphasize during COVID and outside of COVID times, but it is even more important to emphasize that now.
And what about a school district in terms of how will they be held accountable if again, they don't know or they do know? I think there's a lot of fear in sending a child to school, whether they may be sick or they may contract the virus. And what about protecting our teachers as a whole?
I mean, I think the schools have to continue to, have that rigorous screening process and making sure that the temperatures are taken every day and follow through on their social distancing, wearing of the cloth face coverings and all of their process and procedures to really protect both the students, the faculty, and others who are come in contact with either students or the school. So, following through on the objectives that they set forward in their plan is what they're responsible for doing.
Okay.
Can you just clarify on that, the questionnaire that parents or other information besides taking the temperature that a parent is required or expected to do under the guidance?
So I believe the recommended questions, asking about the symptoms, if they have any symptoms consistent with COVID-19, if they've been in close contact with anyone who has tested positive for COVID-19, if they have tested positive for COVID-19 in the last 14 days, or if they have traveled to one of the states that have been identified in the current travel advisory within the last 14 days.
And how often does the parent has to complete the questionnaire? Just so.
So that is specific at the school level. It is recommended that that is done for teachers and faculty on a daily basis and on a regular basis for students.
Okay, thank you. Thank you very much. It's helpful to know. I think you've heard the concerns of parents, of teachers, certainly of superintendents and boards of education and our community at large is very great. And I would, I'm going to close with the health department, but I would like to reassert, I think our collective interest in either having a portal, a hotline, or some other direct way in which people can ask questions of the State Department of Health, not only their local Department of Health, not only their local school district, but they expect guidance from the State Department of Health on these more global health issues. And I just would like to put that before you. So any other questions for the health folks? I would like to mention that I had a conversation with Jim Malatris, who is obviously one of the point person, I would say, and I'm not trying to jump over anyone else, to the governor on some of these issues. This morning, he's indicated his willingness to come back to our committee and have a roundtable with him to answer questions, which I think will be very productive. And I want to thank him for that. And with the opportunity, in addition to talking to the chancellor today, which we're going to do at 11:30, and the interim commissioner, I think the more we can get information out to our constituents on the ground who have very real concerns and very real questions, I think that will benefit us all. So I want to put that before the committee and my colleagues that I'm hopeful we'll be able to schedule that. With that, if there's no more questions for the health department and for, thank you, Mr. Secretary, Assistant Secretary Dan Fuller. We will at 11:30, we have a brief break. At 11:30, we will convene with the Chancellor and with the interim commissioner and with some staff from SED. Thank you all. Well, welcome back. This is a continuation of the Senate Education Committee Roundtable on school reopening. We are joined in the next segment by the Chancellor of the Board of Regents, Dr. Betty Rosa, and the Interim Commissioner of the State Education Department, Shannon Tahoe, and I believe other members of the State Education Department senior team are here as well. And I would like to ask the Chancellor to give some opening remarks. I think she's been listening in, so she understands the way we are working here. And she can address whatever she thinks is appropriate. And then we will jump into questions. And I think you have a good idea of the kinds of questions our colleagues are concerned about. So with that, Chancellor Rosa, thank you so much for joining us.
Well, thank you, Senator Mayer, and thank you to all the senators that are participating today. I'm actually going to just take the 2 minutes and make sure that I also leave a minute for a couple of the questions that did come up. Most of you know that we engaged in a recovering, rebuilding, and renewing task force, which had 3 components. It had the P12, it had the students. We had a robust conversation with our students throughout the state. And also we had higher ed. Higher ed is currently sitting, the actual opening guidance is sitting, being reviewed by the governor's office. Just very quickly, the task force led to our creating the guidance for school districts, which is a document that's on our website, about 150 plus pages. And from that guidance, districts have created, most of the districts have created their plans. Most of you know we had 4 regional meetings comprised of parents, district leaders, experts, and all of that, with a focus on health and safety, 9 buckets, teaching and learning, digital, transportation, social, emotional, special ed, ELS, budget, and HR. And from that, we were very intentional on focusing on developing workable solutions with guidance, regulatory, and policies, with an emphasis on looking at the instructional models, which some of you have already heard about, in-person, hybrid, remote. We also consider the barriers and the challenges with 3 guiding questions in terms of the needs. And again, these needs were very specific to the various communities. It wasn't, you know, we looked at rural, urban, suburban, and so forth. We clearly looked at the digital divide. We looked at trauma, isolation, wellness. We looked at our most vulnerable communities and students. We looked at reopening spaces in terms of scheduling, repurposing, financial investment. You asked some of those questions. How do we pay for these things? Who is really going to make the investments that we need? We need to really give assurances to our districts that they have to do this work, but we have to be partners in this endeavor. Finally, we must be intentional in our approaches. And this is not about, this is about creating a sense of total community across all of the individuals that must touch these issues. And that involves our legislators, our departments, our agencies, and our communities. So with that in mind, we are looking at reopening safely. We're looking at re-entry, because it isn't just about reopening, there's a re-entry in terms of trauma and wellness, and making sure that our kids who have been isolated and also our academic issues are addressed. And this must be done in a way that supports our communities. So with that in mind, I'm going to go to a question that that Senator Liu, you asked about the plans. I have to say, as somebody who has been working very closely with New York City, the chancellor, their team, and by now you know that the mayor has his task force, the chancellor has his task force, and what we've tried to do is really much intersect in many of those conversations. So the clear answer to the plan that went to the DOH was only the plan that was due. Everybody by the 31st had to have a plan that addressed the issue of health and safety. That was it. The full plan is really due for us, for those districts that asked for an extension till August the 7th, is due August the 7th. Now, some districts that completed their full plan submitted their full plan. And that's why you see in some cases the full plan versus just that component. Remember, New York City has 1,800 schools. They are now putting together to submit to us by the 7th their full plan. So it is what has been reviewed. And again, I'm not going to comment on what has been reviewed by DOH, but I can assure you that that is only that component and not the comprehensive plan. I just want to be, for transparency purposes, I think it's important. And it's not just New York City. It's all the districts that asked for extension. They did comply with their, making sure that they got their plan in with DOH, but they have an extension until the 7th to complete their plan. So I just want to make sure that that's out there. And with that, I turn it back to Senator Mayer.
Thank you very much. And before we get into it, I just want to acknowledge Interim Commissioner Tahoe for your leadership, and thank you for managing through this incredibly tough time. We will miss your leadership, and I know working closely with you myself on behalf of the kids, and I appreciate your commitment to the children. So thank you for that. I want to jump right in, Chancellor, on the broadband access issues. This is a statewide problem. It is true in our densest cities, our suburbs, and our rural communities. And yet we don't seem to have a statewide approach yet to fixing it. New Jersey announced they put some money in. California's budget, I think probably through the CARES Act, allocated substantial amount of money to ensure broadband. I don't know how we as a state think we're going to be able to accomplish this remote learning or whatever kind of learning we end up with if every kid doesn't have access to broadband, and I'm leaving out the devices issue. So is the department working with the governor's office or with any other parties that are relevant, working towards a solution as opposed to sort of do the best you can, which I think is the challenge for districts right now?
Well, I'm going to start and then I'm going to turn it over, since we did it. We actually did a survey on this issue. and we included obviously the devices and also the whole internet. And this is an issue in one of our conversations on the digital equity that came up constantly from districts and parents and other stakeholders, that this was so critical. How do you do remote for some children, particularly children that have the resources, and how do you leave behind the communities that are disadvantaged? So this is a conversation that, not only a conversation, but we noted this. For those of you who have gone to our website, we recorded every one of our task force meetings. This was a critical issue. And this was an issue that we realized has to be addressed by all parties involved. The governor's office, state ed, our districts, all of us collectively have to be responsive and responsible to address the broadband, and also the devices and the resources with the internet and everything that is connected to that. But with that, Shannon, you may want to call on Jason or anybody else that has, a little bit of information about the survey.
Yes, of course. Jason, I'll turn to you to talk a little bit about our survey and the efforts that, one of the things that we said in our plans and asked our districts to say in their plans is to tell us, to assess the needs of their districts, where devices are needed, which children have access to internet access, who has access to broadband, and then to actually try to help to address those needs, whether it be through hotspots or other mechanisms or community-based organizations to help with those needs. So that's one of the things that we actually asked our districts in their plans. I've also personally had conversations with the governor's office on this, to address, we really need to apply pressure to the internet service providers to provide, lower cost options for our folks out in the different rural areas or the cities across our state. This is a huge issue. We also need to figure out a way to provide a funding mechanism for districts to have access to devices. So these are issues that, yes, we have raised multiple times, with the governor's office as well. And I will turn it to Jason to talk a little bit about the results of our digital access survey. Or Shannon Logan, if she's on.
Oh, Jason is there. Jason, yeah.
Yeah, thank you, Commissioner. Thank you, Chancellor. So we do have from our those survey results, and I think Deputy Commissioner Kim Wilkins has some additional information that she can layer in. I think when on the digital divide issue, I think it's important, and we saw this from the survey results, that there's multiple components to this, right? That there is a divide both around access to devices themselves, and then also access to internet connectivity that would support effective remote instruction, right? So access to the high-speed connectivity that would be needed in order for those devices to be utilized in a maximum way. That overwhelmingly the cost is a factor in that access issue. And Senator Mayer, as you indicated, that's something that shows up in rural, in urban, and in suburban settings all across the state. In terms of coordination of resources, I know the department has been working to be able to identify funding through programming such as the Smart Schools Bond Act. We've been working to identify with districts access to federal dollars under ESSA, as well as state and local, to be able to have a very coordinated response as they're working to build capacity at the local level. But I would defer to Deputy Commissioner Wilkins for additional details.
No, Jason, you did a wonderful job. You answered it perfectly. And we did do our survey. And unfortunately, we have about 50% of the districts answering back. So we really do want to put the survey back out there because we want to be able to represent the entire state and not just a certain segment of the state. So again, the survey will go out, and there is a connectivity issue, but believe it or not, it wasn't in regards to the broadband on the part of the survey that we did get back. It was really about the resources inside of an urban setting. They could not afford to get to the broadband that was actually offered in the city. So we kept thinking it was going to be around the rural issue, which is very, very much a part of an issue, but it was about having access inside of a city that actually has broadband and MiFi and Wi-Fi capabilities. So the issue is pretty deep-seated. The other thing that we're doing, which I'm very glad of, and I had asked the department to do, we're going to include what's happening with the devices and connectivity on our beds. That goes out every single year. I know our districts just love to get those beds reports to us every year, but we're now going to be asking a series of about 10 to 15 questions every year about connectivity and devices. The last part I want to answer about that with the devices, Senator Mayor, is that we have districts that went ahead and used their funding sources in March, April, and May to order devices, and they still do not have devices right now. There is a supply and demand issue going on because we're competing with the other 49 states. So that's another thing that's happening. We have one district in particular who actually ordered about 2,000 devices and are still waiting from an order they placed in April. So there is some issues around the, getting devices at this time as well.
Well, thank you, Deputy Commissioner. And I know I have a very important question, which I will wait, but I would say that everyone in this call knows that in urban communities, our constituents cannot afford to access the internet, even if it's theoretically there. That's why I believe we need a statewide approach to force these providers to do the right thing and act like utilities that they are, rather than private companies in it for the profit. This is not a moment for that, but that's my soapbox. With that, I will turn it on over to Senator Liu.
Thank you, Madam Chair. On the broadband issue, I'm very much aware, and our colleagues certainly remind us of that in parts of the North Country and the more rural areas, people just don't have Wi-Fi and broadband. In New York City, we don't have the best broadband. There are still lots of dark spots, but it's generally much better than the rural areas. And I don't want to always be criticizing the New York City Department of Education. I think that they did a fairly good job of procuring a 250,000 iPad devices for students within like a month's time. So I give them kudos for that. Not obviously, we still have kids and families who still need devices, but they generally did a pretty good job there. And I so much appreciate Chancellor Rosa's comments. I think she was alluding to the responses that I got from our health colleagues in the health department. Yeah, I was not aware of the extension issue. So, okay, so that's a good thing. So that means the City of New York, the Department of Education has until this coming Friday, the day after tomorrow, the day after tomorrow to get the full plan underway. And so we hope that they will give clarity to parents. I've said many times to Chancellor Carranza that no matter what the department does, there will be lots of people unhappy because there are lots of opinions about whether it's safe for kids and teachers to go back into the buildings, how safe will it be, or is it better just to stay on remote learning, as apparently the Chicago public school system is doing. But even though people won't be happy, it's important to have a clear plan so that parents and the students can figure out what their schedule is going to look like, so that the parents know what kind of flexibility or non-flexibility they have when it comes to their own work schedules. So clarity is really important. I look forward to seeing that. And Chancellor Rosa, I don't mean to put you on the spot, but would you also concur with the health department folks and the representative who spoke on behalf of the second floor before, that in cases where there could be a disagreement or at least a non-consensus between state ed and the state health department, that state health department overrides?
I would say that and I'm going to quote it directly, on page 13 of our document, we put a disclaimer so that all superintendents and anyone who reads our document of over 150 pages, we have clarification that where there is conflict, the health department, DOH, takes the lead. And let me just add one to respond to you. We had the opportunity, as some of you may have noticed, when the governor's office did announce that they would have their on the 13th, which was the same day we were having our regions meeting. We did collaborate. We did have meetings to create one document with 2 components. And we did defer. We took our section and shared that information with them so that they would review. We had follow-up conversations and they had some concerns. And once again, in our FAQ, we were able to make sure that the field knew that these answers were answers based on DOH and the Department of Health, and also that these answers had been coordinated with the second floor at the governor's office. So the coordination, even though we were doing separate task forces focused on the 9 buckets that we did, when we got to the finish line or close to the finish line, we knew that we had to be very intentional in our coordination so that we would give one message to the field and create a seamless approach. And I have to tell you, these superintendents, these communities have worked so hard in making sure that they ask questions, that they're responsive. So yes, we would defer, and we have it even in cases of tracing, page 41, page 55, I can tell you exactly every single area that when there's any doubt, this department that I'm very, very proud of, and this commissioner, we have totally as a community looked at what is a safe way to look at reopening and reentry. And as I said in my former opportunity during the task force, we are staying in our lane, but we also respect the lane that DOH has to travel.
Madam Chancellor, very quick pop quiz. What is the first line on page 127?
I can tell you the first line on page 55. Thank you.
Thank you. Senator Little, do you have a question?
Yes, yeah, thank you very much. And thank you for being here, for Chancellor. Good opportunity to talk. And I represent a lot of rural areas. And yes, we are having a real big problem with internet service. In a survey I did, I had schools that 40 to 50% of the students did not have adequate internet service. And it down around 30, 25, 30% had none. So I think there has to be a way to create hotspots if we do go to total remote. And that's my fear, that if we do have to go back to this again, it just can't be done the way it was done. I mean, it was on the fly and everybody survived, but we have to do it better the next time. Even if you created hotspots at the school, in the gymnasium with cubicles for the kids that did not have internet service at home and had to come into school to get their remote learning, it might be helpful there. The second thing is the buses, 64 passenger bus has got to be able to take more than 22 kids. These kids are going to the grocery store with their families. They're doing other things. They can sit on a bus with a mask on, having their temperature. We've got to emphasize that you cannot send a child to school if they're sick. My mother was a nurse, and believe me, you had to be ready to go to the hospital before you got to stay home. But that can't happen today. You have to be sure that we're not sending them, because we know that through the years, your kids bring home a lot of stuff that they catch in school. That's a big thing. But more importantly than anything, I think, is professional development for the teachers. I cannot imagine what it had to be like to be teaching for 3 months a class of children that you could not see. You really could not work with and get the feel for or anything else. And some did it well and some did not. And my suggestion, and I've suggested it all the way around every week to my BOCES districts, I have 3 BOCES, but take your special professional development days and do them the week of Labor Day and have a really intensive class. Empire State Development, they do everything online, or Empire State College. They must have professors. SUNY Plattsburgh teaches, they're teaching classes. There's people that can be, and they can do it online, but they'd have to be in the school for learning how to do this better than what we did before, and then bring the kids and start it the Monday after Labor Day or something like that. But there's just so much here. I desperately want to see that children get back to school. In my schools, I represent 6 counties, 6,800 square miles. I have several hospitals, I think 5 or 6. Less than 5 people are hospitalized with COVID right now in that entire area. So we are fit to get ready, and my schools are working really hard. They got pretty discouraged when they listened to the governor, and I think all the considerations and what he's hearing from the teachers and fear of going in and all. But many of my schools have a hybrid thing. Some are trying to work totally in the school because they're small, but the bigger ones, they're doing a good job. Some of their high school kids will be in 2 days and online 3 days. And, even if we compress some of the online into a shorter day for kids who are doing it remotely, we might get better accountability and better attendance. But thank you. I appreciate all of this.
Yeah, I want to respond by saying, first and foremost, you have an amazing regent that really gives voice to the issues. I mean, we
Absolutely.
speak,
That was wonderful.
yeah, and we speak, Beverly Orderkirk, we speak all the time, and she really has make sure that her footprints are on the department in many ways. I do also think that your DSs, your participation was unbelievable in terms of our task force and giving feedback around these issues. The other thing about PD is that our department did an amazing job in writing a grant that was focused in the Rethink, that was focused on professional development. $19.9 million are focused on, we knew that our professional development dollars were going to be scarce at best, or non-existent. So we can share with you about the grant along with the rest of the senators. We will make that available so that people know a little bit about this. And maybe I can ask either the commissioner or Kim just to briefly talk about PD.
Yes, I think this was one of the issues, Senator Little, that we heard throughout our state in our reopening meetings was the lack of professional development. We have so many teachers who are wonderful teachers, but they didn't have the knowledge or skills to know how to teach through the online platform or remotely. And this is something that teachers are still honing up their skills on. And so this is what we thought creatively around the Rethink grant. When we submitted our application, it was to provide exactly that, professional development to address our teachers' needs in instructional technologies, best practices with respect to how to use online platforms in an effective manner to teach their children. So this is something that we're hoping, and we're actually working quickly with our contracts folks to get the contracts out there so that we can get the professional development underway, even possibly some of it before the start of the school year. So this is something, and I appreciate you bringing this up because this is something we've heard over and over and over again, and the department is really trying to address in the systematic and effective way, working with our RICs and BOCES to provide this professional development. So thank you.
Thank you. Thank you. And then I'm going to go to Senator Stavisky.
I am unmuted. I have only one question because I know there are time constraints, but let me make a suggestion. The issue came up at the last week's higher ed hearing on COVID and the college students. And I suggested to both SUNY and the independent colleges on the broadband issue that they pool their resources. They have a lot of brain power. And I think they perhaps should include SED in their attempts to improve broadband, because I think, this should be a seamless, Shelley Mayer and I agree that education really should be a seamless transition from kindergarten through college. And I think working together, that will help that. My question concerns the phrase that the chancellor used, the reentry. I was a little perturbed when I was reading yesterday of the second floor's decision not to do the testing that many of us think is necessary, not just the kids, but the staff. Many of the schools in New York City are old. They are shrouded in scaffolding and drop cloths. Windows do not open. I think I've taught in almost every school I've taught with. The windows did never opened. How do you propose to create a healthier environment for the reentry in the old New York City schools?
Well, I'm gonna take that one because of the fact that we've had conversations, even Senator, even about issues of our old-fashioned, where kids wash their hands or drinking water. I mean, you are absolutely, as a former teacher, former superintendent, absolutely. Some of the ventilation issues. I mean, in our plan, we put some ways that school districts could, in fact, address some of these issues. New York City, by the complexity of 1,800 schools, elementary, and as you said, all kinds of construction and all kinds of buildings that are really in disrepair in many kinds of situations. Really, truly, along with New York City Chancellor and the mayor, they really have to address some of the actual concerns about even thinking about repurposing and looking at other spaces, because some of these spaces, as we know, even from 9/11, some of those spaces have not fully recovered. So we are in conversations about looking at issues of ventilations, issues of the space, the health. I have in the Bronx kids with asthma, as not just the Bronx, but in parts of Queens and in other parts, that we have to really look at this in a very drilled down kind of way, because it isn't just about, if we look at communities that are vulnerable, and then we have buildings that are at best questionable, we have to come up with metrics that really truly zoom in on all these issues before we say it is okay for adults and for students to be putting these compromising conditions. So this is way beyond just saying, 6 feet, social distancing, masks, shields, all of that. We have to look at the actual conditions of our spaces in a way that we really take an inventory and know that we can assure our parents, our teachers, our communities that these are safe spaces. And if they're not, what are the ways that we look for other spaces that can accommodate safe spaces?
Inventory?
Thank you.
Is there?
Oh, I'm sorry, go Senator Stavisky.
Just real quick, is there such an inventory in New York City? Because I know that there's asbestos abatement, lead abatement, a lot of those issues exist. Is there an inventory of the schools that are not available?
Well, we're looking for it in their plan, and we've been in communication, and I know, as you
Or is
know.
there for the future?
Oh, no, we can't look at the future. We have to look at reentry. It's the reason I call it beyond reopening is because in order to enter, all of us know that space has to be the kind of space that people feel comfortable. It isn't just about the mask and the social distancing and the barriers and all of that. There are so many components. For those of us who have been principals and superintendents within a space that have to assure our students and our families that these spaces are safe.
Thank you, Chancellor. I'm sorry to cut you off. I just want to make sure everyone gets a chance. Senator Jackson.
Yeah. Good afternoon, Chancellor Rosa. Good to see you again, as always, and thank you for your leadership along with the interim commissioner. I just asked the health commissioner, you may have heard about the coordination of children with special needs and the busing, and especially when they go to New Jersey or Connecticut or Long Island, that's a different school district than New York City. And I heard his response about, from a Department of Health point of view, it's going to be depending on where they go to school at, whether it's Long Island, Connecticut, or New Jersey. But what about all of the coordination with the transportation when there's small buses that are very small that they use in New York City to pick up children with IEP special needs versus the larger buses that Senator Little raised in upstate New York? Whose responsibility is to coordinate that? Is that the city of New York, even though they may be going to another state or another school district? Or is that the State Board of Regents and the State Education Department with children with special needs?
Okay, I'm going to turn it over to Kathleen, but I will say that, again, some of these issues cross over between and making sure that the health piece is priority, and then the chancellor and the mayor coordinate the provisions of scheduling buses, types of buses, and all of that stuff. Kathleen?
Yeah, thank you, Chancellor. So the provisions as to which, just so I understand the question, Senator Jackson, is it whether the safety precautions in New Jersey schools will prevail, or whether the ones from the school district that the young person came from?
No, I understand that, because the safety health takes precedent over the rules and regulations of the State Board of Regents or whatever board. Health is number one. But I'm talking about the coordination where transportation and all of the impacts of that. And what happens, for example, if students in New York City are ready to go to school and New Jersey or Connecticut or Long Island, their schools are not open. And there are children with special needs.
Right. So I think then I would defer to my colleague, Chris Soriano, who is the Assistant Commissioner for Special Education, but their IEP would have to take into account the fact that their school is not open and make adjustments to that.
But who's coordinating all of that? Is the New York City Department of Education?
Yes.
Or State Education
Yes.
Department?
The New York City Department, good afternoon, everybody. The New York City Department of Education committees on special education or committees on preschool special education would be responsible for coordinating the needs of that child. If their program is closed, how are their needs subsequently going to be met while that program is closed? So that would be the Department of Education, working with their committees on special education and preschool special education.
And Chris, as far as the busing, understanding what Senator Little and raised before with the health commissioner, as far as a large bus and you have social distancing, what's the situation with that with respect to the negotiation, the discussions with the bus companies and the unions involved, if you know?
I'm going to defer that transportation question to Christina, but the overall needs of the student with a disability, if they had special needs that required special conditions while being transported, that would be identified on their IEP by the Department of Education Committee on Special Education. But as far as the actual physical conditions that need to be health conditions that need to be in place for transportation during this time period, I'm going to defer to Christina to speak to.
Yes, thank you, Senator. As you know, New York City would have a number of contracts with private providers for the most part to provide that transportation, and they would need to have arrangements in place to address the health needs of the students on the buses. We've said in our guidance that social distancing, that school districts should plan on social distancing on buses. And that would be particularly true where you have students who are vulnerable for health reasons.
Christina, is there a protocol that is being adopted as far as transporting students, whether or not they're children with special needs or regular students, is where can we view the protocol as far as the social distancing and in the cleaning and all of that? Where's that at in New York City Department of Education? So that I can grab that and then show it to any parents that their children are being bused, whether or not with special needs or without special needs.
Well, Senator, I would hope that that would be addressed to some degree in New York City Department of Education's plan, but the New York City Department of Education also has an Office of People Transportation that's fairly sizable, and I would recommend that if you don't see it in the plan, that you should reach out to them.
Okay.
Can I just add, there are a series of school reopening frequently asked questions dated July 22nd, 2020 that I'll circulate to all of our colleagues, that I believe was issued by SED after further conversation. It addresses at least indirectly some of these questions. I will circulate it to all our members. So thank you for that. Senator Martinez, then I have Senator Metzger. Other members of the committee, please indicate if you have questions. Senator Martinez.
Thank you, Senator. And Commissioner, thank you for being here as well. I hope you and your loved ones are well. Just a couple of questions. State assessments, and has there been any discussion on what to do with state assessments, whether they will continue or where they will be suspended? And will a school district be threatened or punished due to funding if they do not continue with state assessments?
Chancellor, you want me to take that one?
Yes.
So yes, this is the question of the day. Every time I go anywhere, this is the first question that comes up is what's happening with state assessments, Regents exams, and APPR. Those are the three top questions, I would say. And so for state assessments, there's a waiver process just as we did last year. The federal government requires that state assessments be conducted in certain grade levels and even in high school. And that's why we have our Regents exams for accountability purposes. Last year, we sought a waiver from the federal government from those accountability determinations, and we were successful in getting the waiver. This year, the federal government, it's my understanding that there's been 3 states that have requested such a waiver, but the federal government has indicated that it's premature at this time because school hasn't even begun. So this is something that's definitely on the Regents' radar and on the department's radar, and we will continue to evaluate whether state assessments or Regents' exams will be conducted this year. But at this point, without even knowing if we're going to be in person, it's a little premature at this point to seek a waiver. So that's something that we'd actually have to seek a waiver from the federal government on for our state assessments and Regents exams for accountability purposes. So until we have that, so we will be evaluating that as the year continues. And on the APPR question, which I get from everyone, I will just put this on your radar screens as well, because I'm getting this across the board. For annual professional performance reviews or evaluations for teachers and administrators. That's a law that you all have enacted, 3012D, and I'm getting a lot of questions about whether or not there'll be any modifications or suspensions of the APPR based at, if we're not in person or in another alternative model going forward. So this is something that I did want to mention to you all as well, since we're getting so many questions about this, and this would be a legislative amendment. So I just wanted to mention that as well. So thank you.
Thank you.
Thank you. I'm sorry, Senator Mayor, I have a couple more questions.
Yeah, sure.
Thank you for that. My next question, and I know it crosses over with Department of Health, but we've had many students and faculty who have been impacted with COVID on a mental state, right? In terms of mental health, and they've been impacted. Are there additional resources or services that the schools will be able to provide students and faculty, and will there be funding? And I know the first thing, and those colleagues of mine who are former educators, such as myself, we very well know that unfortunately the chopping block, right, when certain budget cuts are made, our social workers are the first ones that are looked at to cut, just like our guidance counselors. Are there any conversations based on funding to provide more social workers or mental health counselors in our school districts?
Yeah, I'm going to jump in on that one because that was one of, besides the issue of health and safety, the issue, that's why I mentioned trauma, wellness, isolation, all the things that our students are going through. And in our document, we actually made the whole issue of looking at students and supporting our students in terms of emotional, the whole emotional issue of, again, back to reentry is so critical. Students are going to need a tremendous amount of support and even understanding how school is a social place. And now you have to evaluate and rework some of these other protocols and other rules that really are a contradiction to what our students, for those of us who have been in the field and have done this work. We are looking for not only just the funding part, because you and I know the funding part cuts across everything. Without investments and saying that we want a health and safety environment, but we also have to respond to health and safety children. And in order to do that, we have to do it, as somebody who was involved in community schools, we have to do it across the board to make sure healthy families, healthy students, and make sure that our students' social emotional needs are a priority. And they are a priority in our guidance to schools in terms of how they have developed their plans. So this is a major, major requirement.
Thank you.
And I
Chancellor.
appreciate that, Chancellor. And Senator May, I have two more if that's okay.
No, because I'm sorry. Can I come back to you?
Yeah, definitely.
I'm just worried about time here.
Thank you.
I have Senator Seward, then Senator Metzger.
Yeah, thank you, Senator Mayor. I was pleased that the discussions started around the issue of the broadband access, high-speed broadband, and certainly representing a basically rural district as I do, it's certainly a big problem in the rural areas, but learning today that also in some urban areas. So perhaps we can get an urban-rural coalition going to once and for all solve this issue, because the educational needs of our students and the digital divide, as it's called, it's certainly been exacerbated by this remote learning that we quickly shifted to earlier this year. Also, I would like to know, have all of the school districts submitted their plans to DOH? And you say you have a deadline of this Friday for SED plans. Have all the school districts, because I read somewhere that only 630 school districts of the 700 or so districts have submitted plans.
Kim, I think you've been keeping tally. Dr. Wilkins?
Yes, thank you. And I'm going to ask Jason to get on as well. We have, for our plans, I cannot speak for the DOH plans, but right now we have 100% of our districts have actually got their plans in, with the exception of those districts that actually have asked for an extension. I think we have approximately 55 of those, but we're so happy that all of our districts got them in at this point. And we also have some stratification of non-pubs and some of our other special act schools. So again, the 31st was our first deadline. Anyone who asked for an extension to the 7th, we have granted that because we know it's a lot of work and it's only approximately 55. Jason, please correct me if I'm off, between 55 and 73. What was that final number?
So yeah, so thank you, Kim. So among the surveys that were published out to school districts, to charter schools, and to our special acts, we've received more than 865 of those back. We have 65 that have active extensions through the end of this week. And so overwhelmingly, again, we have the plans. I believe that there's only a limited number that we have not yet received. And so again, as Kim mentioned, we're not able to, I don't know the details of the submissions through the DOH portal, but overwhelmingly we have a sense of where the plan submissions are related to the surveys on the SED side.
Thank you for that. One more question, this time on behalf of Senator Serino, who's not a member of the Education Committee, but did have this question, which I raised with the earlier panel on her behalf, but I'd like to raise it with this panel as well. She says, have you thought about if a teacher is uncomfortable teaching and coming into the school physically for any reason, or if they are perhaps showing symptoms, that could we allow them to be the ones to Zoom into the classroom and have an aide or an education graduate student in the room to supervise the students? So at least we would know that the students are actually paying attention to the lessons, and we know that they're getting the resources at school, like their lunches, etc. And there's someone there to actually monitor their progress and report any concerns. Is this an acceptable, in your estimation, part of a school district's plan as it relates to their teaching faculty?
Dr. Wilkins?
Okay. Well, at this point, I'm going to be very careful answering that because this up to individual districts and how they're going to move forward with their plan when it comes to a vulnerable population of educators as well as parents. So I have to defer over to the DOH parts of this, but then individual districts will come up with that kind of a plan. Senator Siewert, that's a great plan on the surface, but again, it's going to be up to individual districts to figure out how they want to move forward when something like that happens. Also just notice that when the plans are coming through, when you have some of the hybrid situations happening with the districts, we got to be worried about coverage of all classes at this point, especially just with the reopening plans moving forward. So good scenario. Thank you. I'm putting it in the memory bank right here as a possibility. So thank you for that.
Thank you. Thank you very much. Senator Metzger?
Thank you. And thank you for being here, Chancellor, to answer our questions. I want to also chime in on the broadband issue. I represent counties in the Catskills region, Mid-Hudson region, school districts where up to 20% of households don't have broadband. I first want to ask, will that survey that you're undertaking or have undertaken and continue to undertake be made available? I would love to see it by district. But recognizing that there are different issues happening. There's the affordability issue, there's connection, there's speeds. There's not a lot of time to put solutions in place. We obviously need more resources, and we've talked about that, and I haven't heard any answers to that, but it's got to happen. It's got to come from somewhere, or we're putting our kids at an incredible disadvantage. I heard a really great suggestion from one of my district's superintendents about the possibility of creating online educational centers for those kids that are unserved or underserved. I mean, I could imagine this even just at libraries, but taking advantage of existing resources and setting things up locally. Again, this would need support from the state, I believe. But whether ideas like that have been considered. Another is mapping hotspots in across the state so that free Wi-Fi, so that people in the community know where it's available if they don't have it at home. And just trying to think about what can we put in place now, like quickly. We obviously can't build out broadband infrastructure to every household that needs it between now and the beginning of the school year. So what kinds of solutions are being considered like along those lines?
Well, let me just start very quickly to say, and we'll get the information to everybody through Senator Mayer. The other part is that our task force gave us so many phenomenal creative ideas because there were so many participants from so many places. So those are up on the website, but we will take that composite and pull those, because that's a great resource to even share as kind of a depository. Mm-hmm. So we will do the same with that, so that districts, even though they've developed their plans, and many of them, by the way, superintendents have been phenomenal in sharing ideas. And we have been looking at the various ideas and posting them so that they could also create their own networks of sharing information. So we hope to not only continue the broader conversation on this issue, understanding that it's going to take all of us to identify this, but also on the short term with the funding that we have about the Rethink and the funding that we have that we hope to pretty much get to our places that need the support. We hope to also make sure that on your local level, that you have a fuller understanding of the kinds of things that we can in fact share, and make sure that people have a broader creative way to respond to this, because it's going to take beyond funding. It's also going to take a lot of creativity and a lot of sharing and a lot of lifting each other up during this, I call it leading with compassion, leading with a sense of gratitude, but also empathy during this whole situation. So I think I thank you for your question, and we look forward to making sure that you have some of these this information that we were able to get from our task force as well.
And Chancellor Rose, if I could just mention one thing, Senator Metzger, we also have been exploring, obviously we have the Cultural Education Center that's part of SED in our mission. We have also been looking at ways in which to enhance the libraries, just as you've indicated, and using libraries as potential spots for students to go. This is something I've been working with Lauren Moore and a couple of our other folks in our libraries unit to basically see how we can best leverage those resources as well. If we are back in a remote setting or in areas of the rural areas of the state where parents might be able to go to the libraries to access those computers or online materials. So this is something that we are actually looking at right now to try to get something through.
I do want to just say I really appreciated in your guidance that you emphasize that kids that are not connected, don't have that resource, really get prioritized in in-person learning. I think that was very important. But yes, anything we can do, because it's just a huge disadvantage. So I appreciate it.
This is the issue you're raising is probably one of the most significant challenges of right now. If we don't do something immediately, and I've had these conversations with the governor's office too, we need to apply pressure on the internet service providers.
Yes.
We need to get our other state agencies together. Obviously, SED only has a limited role in this, but we need to partner with all of our state agencies and anybody that's willing to help on this issue, because if we don't address this soon, these kids are going to be having severe academic deficits going forward. Also, maybe having like a digital summit or something where we're engaging all of our partners across the state to try to figure out this solution, because we need to do it for our kids. We need
Right.
to.
Except the ones with the broadband.
I'm going to stop you because I see Senator Brooks has a question. Senator Adabo, do you have a question as well? Oh, Senator Brooks, go ahead.
Thank you, Senator Mayer. This may have been covered already. Unfortunately, we tied up with something a little earlier, but I want to pick up on what the commissioner just spoke about and the ongoing discussion you had with the broadband. I absolutely agree with your comments that we've got to bring the libraries into this system. I would love to see that you establish a minimum level of operation, if you will, for distance learning in terms of the broadband and services. And that becomes part of next year's budget so that we get funding to some of those districts. The libraries, I meet with my libraries in the district quite frequently. They're very much involved in what's happening with these students. They've got good networks up. I think particularly as we look at situations where we have childcare programs, problems, I should say, in some areas, these students can go to the library after school, get the attention they need and the assistance. These we all recognize are challenging times, and money is going to be a very big challenge. But my question would be, and you may have answered it, that's why I want to say that up front, are you planning to put significant funding in the educational budget, inclusive of the libraries, for expansion of distance learning and broadband support?
Senator, we spoke about a grant that we just received on Rethinking that's both professional development and doing some of this work as well. But on the budget part, is Phyllis on the line?
Yes, I'm here. Hi, everyone. I'm trying to start my video. Here we go. Well, I'm the Chief Financial Officer for the State Education Department. And yes, the funding is through the reopening task force meetings. This was certainly something that we heard quite a bit about, concerns about funding, especially in light of the state's budget deficit and the uncertainties with state aid levels going forward. So we're certainly advocating and supporting increased funding. We have allocated funds through the Federal CARES Act to districts, and those funds can be used for equipment and technology to help with distance learning. That was one of the primary focuses of the CARES Act. And as Chancellor mentioned, we did receive additional funding through the Rethink grant for professional development to help teachers better prepare to conduct distance learning. We also have the Smart Start bond funding, and we have expedited, Christina Copland's on the line, we have expedited the approval of, recently the board met and 150 school district plans were approved to provide additional equipment and devices and hotspots for students. Unfortunately, as was mentioned previously, every school district in the country is looking for devices. And so there's just some supply chain challenges in terms of just now that we have money available for these devices, just actually getting them in the hands of the teachers and the students is just our next challenge.
Yeah, I recognize that the problem with the availability of some equipment. My question is, are you going to come up with a minimum standard we want all districts to be at, say, the end of the school year 2005, just for number? Because I do think we should know education across the state's opportunities should be equal. If we at least have everybody at a minimum platform, we know something's there, and to get some guidance. And yes, the funding and the manufacturing of the equipment is going to be difficult, but in my district alone, I see the different situations we have from one district to another as to where they are. And I think we should come up in the near term with a minimum standard of operating efficiencies from an internet standpoint that every district has. And then where the districts are economically challenged in the rural districts, some of the availability of the broadband, that we bring those educational systems up to speed.
Can I just ask if you answer the question, because we're running out of time?
Yeah.
I think Phyllis, maybe, were you going to answer, or somebody answer on this question of minimum standards that Senator Brooks has raised?
I think that's something that we need to take back and take a look at. I certainly understand your point. And we'll take that back and let you know. I think, it is challenging with the funding without, the funding isn't completely in our control. So that makes it a little bit difficult in terms of setting minimum standards, but we'll certainly take that back and
thank you.
Thank you. Is Senator Montgomery on the phone? Do you have a question, Senator Montgomery?
Thank you. No, I don't have questions. I just want to thank the Chancellor and the Regents and the Commissioner for their leadership, and hopefully we'll get back to normal. I'm especially concerned about what you've done to raise the standards of high schools through the early college program. So that's my off the topic comment for today. Thank you.
Thank you, Senator Montgomery. I'm going to go back to the second round. I have an issue that we haven't talked about yet. I feel very strongly about it. There are thousands of, not millions, of working parents, many of whom are mothers, who are going to go back to work in September, regardless of whether schools are open half-time, full-time, or not at all. Are we coordinating in the education silo with the child care providers, the after-school providers, the child care resource and referral agencies throughout the state to ensure that there is enough intersection about what should parents do? What are they going to do when schools close 2 days, 3 days? Senator Metzger just said her kids have 4 days a month. The balance of the time, are we working it out so that we're not in an urgent crisis when we understand what's going to happen? So I feel very passionately about these parents, and I've heard from them in my district and throughout the state. They are panicked about what they're going to do, and are we working to find a solution for them?
Yes, and Senator Mayer, I can take that question. That's one, I mean, I too understand this with 3 children of my own. Childcare is going to be very problematic for a lot of parents across the state, particularly if we're in a hybrid model with in-person a couple of days and remote a couple of other days. This is something we've asked each district to be working with their community-based organizations, the childcare providers in their actual regions, because the childcare providers, we need to be aware of what the availability is and what kind of after-school programs there are, what kind of childcare their programs there are for the days in which they can't be providing, in-person instruction if that's the methodology that they choose. So this is something they should be working with all their community-based organizations when developing their reopening plans in their communities, because I think you're right. We have to know the availability of childcare and what's affordable and what's out there in their regions for these parents, because otherwise we're going to have parents that won't be able to return to work. And that's going to be a problem. So, and this is going to create a community problem too. So the entire community needs to be involved in these reopening plans and the development of these plans.
Can I just suggest that I think it needs to go beyond the school district. This is not their comfort level, and yet parents are entitled to know this. So I am suggesting that state ed, perhaps with the governor's office and our regional areas that we have for purposes of reopening, work out a childcare and after-school portal so that parents can figure out what is available, what is affordable, and not have to rely on the school district to figure out childcare options. That is not something I think they're all particularly good at. So I appreciate the attention to it, and I think it's going to bubble up as a very real issue, and I appreciate the department's willingness to continue to work on that. I think I skipped over Senator Addabbo, and he should have been in the first round. Senator Addabbo.
It's okay, Madam Chair, and thank you. And I just want to add something to Senator Brooks said about the libraries, which I think is very important. But as we're doing this roundtable, I've been texting Queens Libraries. Queens Libraries, just in my little neck of the woods, has in the past provided mobile hotspots to the Department of Ed in the city. So, Chancellor, I want to thank you and everyone else at the State Department of Ed for your efforts. And I think this is a way libraries can help. If they can't open their doors to have people come in, giving out mobile hotspots certainly has helped. And I understand from Queens Libraries, they're also helping in childcare, offering space for childcare, but again, in a very safe, socially distanced setting. But mobile hotspots becomes, a thing, a measure that we can certainly look forward to going forward with and trying to help out the situation with regards to remote learning. So thank you.
Okay. And any answer, or should we move on? Chancellor, did you want to?
Yeah, I just want to go back to something you said that was critical, because Senator Addabbo made the point of how a community has to work together. But I do agree with you. This has to be bumped up to a higher level, because we were caught off guard, because childcare has never been part of the department's landscape. And I truly believe that we now have to step up and make sure that we don't wait, but rather begin to have the comprehensive responses, and also make available, as you said, the information so that parents are not just waiting for somebody to tell them we have a program at the YMCA, or we have a program, but rather really creating not only a way to get the information out through the school district, but even beyond in some of the organizations. I truly agree with you. We have to do a better job in supporting parents, particularly poor parents or parents that have no choice. For those that can provide, that's one thing. But I do believe that we have so many parents that have to go to work. And so we have to treat it just like we did the first responders. I think we have to treat our parents as if all of them have to go to work, and then create different path of vehicles to give them options of how do we do that. And we have to do that together.
And I've just confirmed as well, Senator Mayor, you had asked the question, there is an OCFS regional childcare portal for families to jump onto, and we can circulate that link to you and the senators as well. So I just wanted to update you on that.
Okay, I appreciate that, but again, parents are not going to know OCFS is the place to go. It's our job to make it work for parents, not the other way around. So I'm still going to press for a unified portal for parents for these kinds of questions. But I appreciate that, and I know OCFS is working on these issues. Senator, someone had a follow-up that I didn't get to. Senator Liu, I think, second round. Senator Martinez. Any other senator before we run out of time? Please let Senator Little. After Senator Liu, I'll come back to you.
Thank you.
Senator Liu, be quick.
Okay, I want to take half a second to say thank you to our interim Commissioner Tahoe. She stepped into a role unexpectedly, and she really has stepped up in so many different ways, including working on some of the issues that have long been out there unresolved. So thank you, Commissioner Tahoe, for your service. This might be the last time I get to thank you publicly. I do have a question because I found your comments to be very interesting, especially when you said that you hear these questions every day about standards, about presumably standards going forward, not just during this time when we're dealing with COVID-19. Are there considerations happening that talk about standards, state assessments, both for students and teachers going forward, or are you really talking about the considerations just during this time when we're dealing with remote learning before things get back to normal?
The issues I've been hearing around state assessments and regents exams have really been surrounding this COVID crisis. However, this is, as you know, this is something that the regents and the department are invested in, and that's why we've been having those regional, before the COVID crisis began, the regents and the department had been working on reevaluating and rethinking what our graduation measures in New York State are, and thinking through those issues. And we've held several regional meetings across the state before COVID began. And I think during this next school year, the regents will be, doing that again and diving into those very, very intricate issues. So yes, this is something that we are thinking about globally, not just through the COVID crisis, but just to answer your question. So yes, we'll be.
Okay, and I know Chancellor Rosa has talked about this with our colleagues as well, both publicly and privately. I will say, Madam Chair, that this is an issue that we need to keep an eye on from the New York City perspective. It seems like the Department of Education is just solely focused on reopening or getting ready for the fall semester. And it's almost like nobody has any time or bandwidth to deal with some of the issues surrounding standards, surrounding equity, the possible interplay between the two. So I just want to say those are issues that I certainly am keeping my eye on and that we'll have to deal with as a committee. Thank you.
Thank you. Thank you, Senator Liu. Senator Little, and then I know Senator Martinez.
Okay, thank you. I think I'm unmuted, correct?
Yes.
Okay, thank you so much. And thank you, Senator Mayor, for putting this on, putting it together, and to our education partners. Uncharted waters we are through, but you've done a fabulous job, and nothing is perfect, but we're getting better as we go along. I just want to speak on behalf of rural areas. As I'm listening, I hear a lot of the urban areas, more populated areas, you really do have some issues getting that number of kids into schools. I just hope that we look at these regions as those that can go to school, because as you mentioned, Senator Mayor, you talked about childcare, which we have hardly any. And in rural areas, it's just impossible. You're going to find kids just hanging out at home, waiting for their online, and thank God for television they have. But this is something that in my area, I really believe the children are better off to be in school. We have the space, we have the ability to do it. And other than the busing, getting more kids on the bus and getting more internet and doing something to supplement that, I hope that we get considered differently. Just we are somewhat different, and we're certainly very spacious. So thank you.
Thank you, Senator Little. Senator Martinez.
Thank you, Senator. All right, I just have two final points. And again, thank you, the Commission and the Chancellor, for being here with us and everything that you have done. Quickly, I'm not sure if any discussion has been held regarding the option of an in-person versus virtual for both students and teachers. And regarding, in regards to the actual conversation and discussion, the affordability of it. And I know we were talking about devices before, but just the whole option of in-person versus virtual. And will also schools be mandated to have the same or comparable HVACs as we are having put into our malls? And if so, I believe that they should, but I also believe that we should not be holding anything, from our parents and families from our school districts. So those pretty are my last two questions, whether students and teachers will have the option of in-person versus virtual, and will schools be mandated to have same or comparable HVACs?
First and foremost, back to your question, I'm going to combine it with Senator Little. We stated right up front that individual communities and district plans, it shouldn't be one size fits all. And that was from the very beginning. We stated that at every single one of our task force conversations. The dialogue has to be about the differences, the various needs, and almost as different as fingerprints. Which is why individual communities are developing plans. And those plans have common threads, but they also have differences. And so to respond, if somebody goes with all hybrid, or as Senator Little, you said, if they go into having the space and having the buildings where they could do in-person with a combination of maybe a small group that may have medical or fragile, because we also have to remember, we haven't talked about it, but we did talk a little bit about the special needs, but we also have English language learners that have very specific needs as well. And so I think that to answer your question, the plans are going to really signal and some of these are contractual as well. So what are the specifics of the plan based on the conversations that are taking place, whether it's hybrid or in-person hybrid or combination or all in person. So those individual plans in those individual communities are the responses to the community's needs. And we will be working with the individual communities to make sure, along with what we've said, you've had the conversations earlier about what constitutes, keeping kids in school, closures, all of that stuff is part of this conversation as well.
And Chancellor, and I thank you for that. And I think what schools are experiencing throughout the state is that they are feeling they are being pinned against one another, and that there is no clear direction from state ed of what to do. And I understand there is, one plan does not fit another school district, but I think they are so frustrated that they are not getting any type of response for them to move forward. And I know they just submitted their plans, but they feel that, I have one school district, which is a very tiny school district, and literally the next border is the largest school district in suburbia. So it kind of makes it very difficult, and it kind of points fingers. Well, why are they doing that? Why can't we do that? And I get it, right? But that's the frustration that schools are feeling right now, at least within my district.
Can I just, I know that I think Senator Metzger wanted to ask a brief question. I want to end, we promised 12:45. And I just want to acknowledge that there are a number of issues we have not been able to delve into deeply enough. The special ed and IEP on the education side, some of our special act schools, and our schools are 4201s. A lot of our schools for children with special needs, we have not been able to focus on. Certainly funding inequities, which is a basic problem that we are well aware of, that is not resolved, and in fact is exacerbated by this crisis. So I would encourage, those that are watching to recognize this is a small part of a much bigger, complex conversation. We're highly aware that there's much more to be talked about in education. This was a start. We're very, very honored to have our guests among us today. but do not think that we have covered even scratch the surface on the most compelling issues about education. Everyone in this call totally gets that. And we appreciate that we have colleagues in government, in the state education department, the health department, the governor's office, who understand that this is the most challenging and most fundamental justice issue of our time. And we are doing our best under very difficult circumstances. So with that, if Senator Metzger, if you could briefly ask your question, then I'm going to let our guest go.
So this is just a quick kind of follow-up to Senator Martinez's question about investments in the classroom infrastructure. I brought this up with the health commissioner earlier. I think that we have to do more to encourage and support outdoor classrooms as an alternative for, there's a lot of space out here where I live, but I think there are also, there is infrastructure in place in many communities. There are parks with pavilions. It's so out of the box that my concern is that school districts may not be considering it. And it's the healthiest possible alternative, I think, especially if the, HVAC systems are antiquated and the like.
Any response?
And that's a great point. That's something we actually encourage in our plans as well. And in our guidance is that districts really consider those outdoor spaces as an alternative because like you said, the ventilation and obviously is much better outside and it might be a good source for some of our districts to conduct their classes.
So with that, I want to thank Chancellor Rosa. Thank you so much for your leadership and your willingness to to answer every question and to really engage with us. I know this won't be the end. You've been so accessible. We appreciate it. Interim Commissioner Tahoe, thank you, as everyone has said, for your service and for your stepping in the most challenging time and really being a great advocate for kids and parents and the entire school infrastructure. Thank you. To the rest of our guests from State Ed, thank you for being here and answering our questions. And to my colleagues, thank you for a very thoughtful and elucidating conversation. I think we've learned more. We have more to do. We will be wanting more up-to-date information on a regular basis. I'll try to push it out from my office, but we look forward to making sure that from you and from the health department, the governor's office, information gets to us as elected officials so that we can give it directly at the grassroots to our constituents, our districts, our parents, and our teachers. And to everyone else in the school community, thank you for your participation. And certainly to the IT staff that facilitated this today, thank you very much to Stanley and the rest of the team. So with that, I think anyone else want to say anything in closing?
Thank you, Madam Chair.
Oh,
Yeah, thank you, Madam Chair.
Thank you, everybody.
Thank you.
Goodbye. Thanks all.
Bye-bye.
Well.